what are some key, and I'm talking about maybe 2 or 3 at most, key nugget lessons that you've gained, that you've learned in working with this population that you think it would be best for people to hear? And I'll just go down the line. So, Dwain?
Glad you asked. Definitely, I would say consistency and transparency. When youth are relying on you to be there on this Sunday or that Thursday because you claim that you're going to have a program, you should, stand true to your word and be there. And transparency, as we talked about earlier, sometimes we need to step outside the box and open up, because within the family structure, the root is communication. So being transparent and consistent.
Thank you, Dwain. Susan?
All right. We need to mobilize young men to support each other and to recognize that these issues are important, but also recognize that there's many other things that are important to young men. And we need to capitalize on their interests in a variety of things to get them into a program. So they're not terribly interested usually in coming to an HIV prevention program, but a program that addresses other kinds of needs, especially their social needs, their chance to be with other young men in a non-cruising area is really important to build on. And then once you have them there, then infuse HIV prevention, talk about the importance of testing, but still keep it fun for the guys to come to, or else they'll stop coming.
All right. Thank you, Susan. Greg, I'd like to invite you to share.
Thanks. I think one of the key things is really, that everybody has talked about already in terms of family, creating a sense of community, of family, of being positive and affirming of each other, and trying to combat those norms that might push people down. And then instead, our projects are trying to instill pride in people, make them feel really good about being a young gay or bi or other MSM man of color, and that they have a sense of racial pride, pride in who they are sexually, and that it helps combat the negative images that we see all the time in society today.
Thank you so much, Greg. John, what pearls of wisdom, what pearls would you like to share?
I think I have 2 points, which is owning it and self-care. So we didn't get to hit a lot on the linkage to care part, but how you in your role or position can own assisting young gay men or anyone who's HIV into care. And so owning your program, meaning using CLEAR, CRCS, as a conduit to sustain people until the first medical appointment occurs or the first case management appointment occurs. Not to see your intervention as something adjunct, but integrated into mobilizing the person to adapt in a lifestyle to live with HIV very healthy. The other one is self-care. So anyone in this work, we are givers. We'll give our last. But what's important, and I heard Ayala Van Zant say this, what's in the cup is for you. What runneth over is for the community. So remember that. Constantly keep yourself replenished and ready for the renewing.
All right. Thank you, John. And Miguel, you were the last to cast pearls, so...
Wow, it's really bad to be the last one because you guys already gave the great advice. Well, if there's anything that I can say is talk to the population that you're going to serve before implementing. Talk to them a lot. And then you will know what changes, or what you need to prepare in order to serve them better. And the second one will be do partnerships. Partner with other service providers to provide the support that all these youth need besides prevention services.
Thank you, Miguel.